Typically, if you have health insurance through your employer, the company you work for will pay at least 50% of the cost of the insurance. Some companies pay as much as 80% or more of the premium costs. Premiums, or the monthly costs of the insurance, can vary, but on average, a monthly premium for an individual can cost $300 monthly, and to cover a family can cost $700 or more monthly. Premiums also increase as you age, so the older you are, the higher your premiums become. If you do not have insurance through the company you work for, then you have to pay all this premium yourself. And it will also be higher because insurance companies charge more to individuals who buy insurance than to companies who buy insurance under a group plan. In other words, if you can buy insurance as a group, you get a better rate. Does this sound like a fair system to you?
Honestly, no, because you get the same coverage. And just because you're by yourself, you have to raise up the price. I think it should be the other way around, where you raise up the price on the group because you have multiple people paying for the coverage, and when it's just themselves, they could they pretty much suffer from the cost of it.
They could suffer by, since they have so many bills that they need to pay, and then they might be the only one that's working there in their own business. So it would be unfair for them. Now let's talk about actual healthcare costs. Did you know that if you have an emergency or in an accident and the ambulance is called to take you to the hospital, that the ride can cost you $500 to $1,000, depending on the city you are in?
Honestly, no, because I thought it was free, and I think my mom was aware of it because at the time I didn't have Medicaid when I broke my ankle, and my mom had to take me in her car. So for getting an ambulance to come, now I know why.
Yeah, I had no idea.
Honestly, if I knew that, I would have gone in the car or take the bus automatically over there.
Typically, if you are in a critical condition, that is, your life is in danger, and you are placed in intensive care, the daily cost of the stay in the intensive care unit can be $2,000 to $3,000 per day, depending on what service have to be provided to you. The daily cost in a regular hospital room can run $500 to $750 per day. Were you aware of that?
Somewhat. My grandfather had surgery on his stomach, and he had to stay in the hospital for 2 weeks, and we got the bill for it, and I thought the bill was for the surgery, the tubes he had to use, and all the IVs. And I re-looked at it, and it was just for the room alone. And then later the bill came for the surgery.
And then with my mother, when she was having my sister, she was nice and she was okay, but then when we saw the bill, it was just a nightmare.
Yeah, it's you just your eyes are about to pop out just because you see the number.
When someone is in an accident or requires emergency care, the first thing paramedics will ask you is if you have health insurance and who it is with. When they may ask you which hospital you prefer to go based on your insurance, this may not be necessarily the closest hospital. If you do not have insurance, then you will most likely be sent to the county hospital, which in San Antonio is called University Hospital. Many times when you hear an accident or crime report on the news, the reporter will mention that the person was taken to University Hospital or the county hospital for treatment. However, because there are so many people who are uninsured, these county hospitals are overwhelmed with patients, and typically there can be a wait of 6 hours or more for patients to be seen in an emergency room, unless there is a life-threatening event. However, if you are taken to a private hospital, your wait will be probably less than 2 hours to be treated. What do you think may be some of the consequences of these differences in the time it takes to receive treatment?
Well, the longer you wait, the riskier it's going to get with anything you have. Like if it's a spider bite, it could get more affected, and just if you need the medicine right there and then, so for waiting that long.
And then sometimes they might not even know what's going on with you until they check, and then it might be already too late.
You have to live with it for the rest of your life, and you can't do nothing about it. You had to wait those 6 hours. So
Instead of waiting those 3.
yes, it kind of helps if it was kind of faster, and the wait, it doesn't really help at all whatsoever.
One of the major issues of the healthcare debate is whether or not there should be a public option. That is, insurance that would be offered to the public that could compete with private insurance. Some people believe that this would be unfair to insurance companies because private insurance companies provide their service to make a profit for their shareholders, and a government-run program does not. This could then put them out of business. What do you think about that argument?
Well, just because they denied the people, well, they still need coverage. And I kind of see the point of both sides. Because, well, you're a company, you're going to want to expand. You're going to want the customers to come to you and have that money. But if you deny them and they need help in the government, well, it's the upside for the people that got denied because now they get covered.
And then I also say that, yeah, they have something on both sides, like, but I think the people who weren't able to be accepted, they should go to the government, and then also that the people who are with the business, that they should have a period of time to stay with them, and then if they like them better, they should stay.